Welcome to the central line insertion video series. In this fourth video, we will demonstrate recommended infection control practices for central line insertion, including the implementation of maximal barrier precautions. To ensure optimal skin disinfection, use a 2% chlorhexidine solution in 70% isopropyl alcohol. Activate the applicator by firmly pressing the handle until a distinct click is heard and a visible color change occurs on the applicator head. Scrub the insertion site vigorously using back and forth motion for 30 seconds, then work outward to several inches around planned insertion site. For moist sites, such as the femoral site, extend the scrub time to 2 minutes. Maintain a sterile field by properly discarding all used items in the biohazard waste bag. Prior to draping, allow the prepared skin to air dry completely for approximately 2 minutes to ensure optimal disinfectant effectiveness. Avoid fanning or blotting the skin, which can contaminate the field. Cover the patient completely with the sterile drape. Instruct the assistant to aseptically unfold and position it, maintaining sterility. If using ultrasound, ensure the probe and machine were fully cleaned and disinfected. Use sterile ultrasound cover and gel provided in central line kit. Do not use non-sterile gel after patient skin disinfection. Have the assistant hold the probe while the inserter applies the sterile cover. Maintain aseptic technique throughout the procedure, avoiding contact with non-sterile surfaces. If the ultrasound probe cover sterility is compromised, for example, touched by non-sterile personnel or surfaces, replace it. After central line insertion, immediately attach Q-site to each port and apply appropriate caps to all ports to prevent blood leakage and air entry. Secure the line in place and then carefully remove the sterile drape. Avoid suturing or securing the device at an acute angle to the skin, as this increases the risk of bleeding. Cleanse the insertion site of any blood. Redisinfect with 2% chlorhexidine gluconate in 70% alcohol before applying the dressing. Place the sterile chlorhexidine dressing over the insertion site, making sure the center chlorhexidine part of the dressing covers the insertion site. Smooth down all edges firmly to ensure complete adhesion to the skin, preventing any gaps. Secure the dressing edges using securement tape as recommended by the manufacturer to prevent dislodgement and catheter movement. Remember, label the dressing with the date of insertion and other required information per hospital policy. Ensure the insertion site remains clearly visible. Change the transparent dressing every 7 days. Replace it immediately if soiled, wet, or dislodged. Change the gauze dressing every 48 hours or as needed. Chlorhexidine dressing is ineffective with gauze in place. Replace with a new chlorhexidine dressing once gauze is removed.